All right. So welcome everybody to the College of Nursing 2-year transfer cohort presentation. This is your advising workshop to sort of get you prepared and ready to register for those fall quarter classes. We have a lot of information to get through, so we're going to go ahead and jump in. Just a couple of introductions. My name is Rhonda Mitchell. I am one of the academic advisors within the College of Nursing. I predominantly have worked with the transfer students, but I also work with some of our admitted students who are coming in as the 4-year traditional cohort as well. I will go ahead and let my colleague Grace introduce herself.
Hello, all. Welcome. So glad you're all here this evening. My name is Grace Laguna. I use she, her pronouns, and I'm an academic advisor as well in the College of Nursing, supporting transfer students like yourselves and also the 4-year BSN students.
All right, thanks, Grace. Okay, so I'm going to do a screen share and then we'll go ahead and get started with the presentation. Grace, if you'll just let me know if that's showing up on the screen for everybody. All right, great. Well, as I said, welcome everybody. We're super happy to have you joining us in the College of Nursing and having us be part of your nursing journey. You'll be with us for 2 years as part of the 2-year transfer BSN cohort. As I mentioned, we have quite a bit to cover, so there we go. Here's the agenda. I'm not going to go over each of the individual items, but this is all of the information that we're going to provide for you. So by the end of the presentation, you should have some information about all of these items. We've already done the introductions. So again, Grace and I have introduced ourselves. Two of the other advisors that are in the College of Nursing that were not able to join us this evening are Nancy Fang and Natasha Malyuk. So as you're emailing us with questions and things over the summer, you may get some information from them or may have already interacted with them. There will be other folks within the College of Nursing that you will interact with as you get started with the program and over the summer as well, but these are the College of Nursing professional advisors. So a little bit about our advising model. So we have two types of advisors. We have professional advisors, which are Grace and I are considered professional advisors. We are considered professional advisors because we know the higher ed, we know policies, processes, forms, all of those things about higher education and supporting students with classes and registration and challenges that come up with throughout the year. What we don't have is direct experience as nurses or nursing classes. Like we've never been through nursing school. We've not worked in the healthcare field as nurses. But we do know a good bit about the classes and helping manage your first year in the program. Your senior year, you will be transitioned from your professional advisors to your faculty advisors. And so your faculty advisors will do a little bit more career discernment, talking to you about different type of nursing areas or specializations. They're also going to talk with you more specifically about the NCLEX or your final RN exam preparation, and they're going to support you in that, what it's going to look like once you graduate and start your first job. So that's where your faculty advisors are going to also give you not only the support of advising and getting you registered for your senior year classes, but also a little bit more of that career discernment that the professional advisors aren't necessarily able to provide. Advising is required once per quarter. So for your first year in the program, you'll be required to meet with your advisor. We will be reaching out to you to let you know when it's time to schedule those appointments and when that advising period is opening. So you'll get that information from us at that period of time. So what are you going to do in those advising sessions? Our advising appointments are going to talk about educational planning, right? So we're going to help you map out your program of study. We're going to talk about course selection, registration. If you have registration issues, we help you resolve those. We do a little bit as professional advisors with the career and specialty discussions, but again, most of that will be your faculty advisors. We do talk with you about study abroad. So if study abroad is something that you're interested in doing, we can help you talk about what that looks like and see if that's something that you can plan within your program. We also help you navigate changes and challenges that come up while you're going through the program. We know that your life while you're going through the program does not exist in an academic vacuum. You still have things going on in your personal life, your work life, and things are still happening. And sometimes those can impact one or more of your classes. And so we're here to help you support your needs as you go through those difficult challenges. And so we're here to help you navigate any options that might be available for you. We also can likewise talk to you about changes to your program of study. If something happens where you're not able to continue on with the class or with the program, we'll talk with you about what those next steps might be. We also are here to support you with understanding those university policies and procedures, submitting forms, timelines, deadlines, things like that. We also are here to connect you to resources. So as things come up in your life, there might be resources available to you as a student, available on campus. And so we're here to help navigate you to those resources and help you know what those resources are. We also will help you work out professional mentorship, networking, and then building relationships with your faculty and other students. So your advisee responsibilities, what are those, right? So the main responsibility that you have is really to check and get used to checking your SU student email daily. We have students all the time who get in the habit of just checking in once a week, and they miss really important College of Nursing deadlines, whether that's for scholarships, clinicals, important information. So please get into the habit of checking your SU email at least once a day, so that you're not missing some of those important emails and information. Being accountable, right? Showing up, attending classes, getting to know your faculty, getting to know us as your advisors, reaching out to us when you have questions or concerns or challenges that come up. We're here to help support you through those and help navigate impacts and what those might look like as you go through the program. Meeting with us regularly, right? As I mentioned, for your first year, advising appointments are going to be required. So you'll be required to meet with your advisor to get your plan approved and to be able to register for your classes. Knowing your degree requirements, right? We have a lot of software and platforms that are going to help you know what your degree requirements are. We have a lot of support to help through that. But it is still on you as a student to know what your degree requirements are and to track those in your degree audit system that we provide for you. And then knowing the rules, again, that's something that we will help support you through, is learning those policies, procedures, deadlines, and things like that. We do have a BSN student handbook. There's a link in the checklist at the very end of this that you'll have access to. So you'll be able to get access to that handbook as well. So the main thing is we're here to support you through your journey to becoming a nurse during your time at Seattle University. So the program, if you've gone through any of the information sessions or attended any of the admitted student days, hopefully you've seen a little program of study that shows the 2-year program. It is 7 quarters to complete. And so we're going to kind of go over each of the quarters, but it's going to be very quick. We're going to talk a little bit in detail about the fall quarter, just as we get ready to register you for those fall classes. But the other upcoming quarters, we're just going to touch on those because most of the information is going to come in your individual advising appointments as you get started with the program. So your fall quarter is going to be 3 classes. You're going to take what is called a university core or a U-core class, and we're going to talk with you about what those options are. You're also going to take a health assessment and interventions class. So that class is where you're going to learn the skills that you're going to have as a foundation in your clinical classes. So that's going to be things like how to take a pulse, how to take a blood pressure, how to give an injection, how to pass medications, how to do a head-to-toe assessment, how to write a patient report, right? So all of those skills are going to be things that you're going to learn in this health assessment class. So for those of you who work in the healthcare field or have been in the healthcare areas, might have some familiarity with those skills. Others of you in the cohort maybe have not worked in healthcare, and this is where you're going to learn those basic skills so that you'll feel comfortable and ready to start your clinical classes. Your third class is going to be pathophysiology. So, pathophysiology is going to be focused on the diseases, disorders, accidents, and ailments that happen to all the body systems and organs that you're learning about or have learned about in A&P 1 and 2. So, it's going to be sort of that next level class after A&P 1 and A&P 2. So, a lot more new terminology and things that you're going to learn about what happens when those systems have diseases or illnesses or begin to break down. So those are going to be your three classes for the fall quarter. In the winter quarter, this is where you're going to take what's considered probably the most challenging class in the program, and that's pharmacology. So we'll give you a lot more information about how to be prepared and ready to take pharmacology when we meet with you in the fall quarter, but just know that's going to come in your second quarter. You'll have healthcare in the 21st century, where you're going to learn about the history of nursing, learn about the role of nursing and how it's changed over time, and then also a little bit about what it means to be a nurse in contemporary times, whether that's in public health, community nursing, or specialized nursing. So there'll be a lot more information about that. This is where you're going to do your first clinical specialty, so health of older adults. So for every class or every quarter where you have a clinical, you're going to have a theory class where you learn about that population. And then in your clinical class is where you're going to apply that knowledge that you've learned in that theory class. So your first clinical will be promoting health of older adults. Your third quarter is where you're going to take another UCOR class. The third quarter is also where the cohort divides into two different specialties. So half of the cohort will do promoting mental health, theory and clinical. Half of the cohort is going to do promoting reproductive health, theory and clinical. So this is where the cohort divides in half. And we'll talk with you about how you're going to determine what specialty you're going to do in the spring quarter and which one you'll do there. And then you're going to have your research methods. So here you're going to be learning about nursing research and research in the healthcare arena. In the fall of your senior year, you're going to start the first quarter of your population health internship and your promoting health of populations and communities theory class. You're going to learn about what is population health, what does that mean, what does it mean to be a nurse in those roles, and then the internship is where you're going to be placed with some of our community agencies, and you'll get to know the people that they are working with and how they support those folks. You're also going to finish up this second of promoting mental health or reproductive health. So whichever one you took in the spring, you're going to do the other one in this fall quarter. Then in the winter of your senior year, you have another UCOR class, so your third UCOR, and then you're going to have the second of your population health internship, and then you're going to start the next sequence of your specialties. So promoting health of children and families or promoting health of adults. So promoting health of children and families, we call it PEDS. So you'll hear PEDS mentioned all the time. And then promoting health of adults, you'll hear it called MedSurg. And again, those are classes that we're going to talk with you a lot more about as you get to that point. Then in spring of your senior year, in your sixth quarter, you're going to take your final UCOR class. You're going to finish up your year-long population health internship, and then you're going to finish up your theory and clinical, whether that's with PEDS or MedSurg in that quarter. The seventh and final quarter is a summer term. So your first summer between your junior and senior year, you don't have any classes, but the final quarter of the program is in the summer. So you'll actually have classes in that summer of 2027. And you're going to do your senior synthesis, which is your capstone, your transition to professional practice, which is where you're going to learn like doing your resume and interviewing, a practice NCLEX exam, those types of things. And then your senior practicum is your final clinical. And again, we're going to give you a lot more information about what to anticipate for those classes when you get to that point as well. But those are the 7 quarters or the 2 years that you're going to be with us and the classes that you're going to take during that time. Oh, there it is again. Okay. So as you go through the 2 years of the program, we are going to be tracking with you very closely what your academic standing is. So are you staying in good standing with the university and with the College of Nursing? Part of that is your GPA numbers. So we track your cumulative GPA and we track your nursing major GPA. And those are two different numbers that we're going to track. Your cumulative GPA is going to include those UCOR classes and your nursing classes. And you must maintain a 2.0 or higher cumulative GPA to stay in good standing and graduate with your degree at the end of the 2 years. Your nursing major GPA also must be maintained at a 2.0 or higher as you go through the program. And your nursing major classes are the only ones that are going to count towards the nursing major GPA. So UCOR classes do not count towards this GPA. So one thing to note is that all students must earn a C or a 2.0 or higher in every nursing class to be considered passing that class and then be able to progress to the next quarter. So if there's ever a situation where you feel like you're not going to pass the class with a C or higher, please communicate with your advisor as soon as possible if you have any concerns about that, and then we can talk with you about what that looks like and what that might impact, and then talk with you about any interventions that might need to happen. Um, all right. So we've talked a lot about and mentioned quite a few times UCOR classes and those requirements. So what are UCOR classes? So we are a liberal arts school. So that means we have liberal arts requirements as all of our degree requirements. Those are what we call our university core or UCOR classes. Those are classes that you're going to take that are going to enhance your Jesuit education. They're going to foster interdisciplinary thinking because you're going to be taking these classes with students from other colleges within the university. It's going to sharpen your critical analysis because you're going to be doing a lot of self-reflection, community reflection, and really learning some different perspectives maybe than you've been exposed to previously. And then we're going to provide a holistic and global perspective. So most of our classes are going to have a global perspective, but we also provide that holistic perspective because our whole mission is about educating you as a whole person so that you can go into your nursing career and focus on your patients as a whole person as well. So our UCOR classes are structured in what we call modules. And those modules are Module 1, which is our 1,000 level classes. And if any of you have been kind of exploring in your student portal and looked at your program evaluation, you might have already seen some of these classes and requirements. But typically, most or all of your Module 1 classes are going to be satisfied with transfer credits that you're bringing in from your current school. There are some instances where some of you might have one or two of those 1,000 level classes to take as an additional class. If you're not sure if you're in that situation, please work with your admissions counselor to determine if that's something that you're going to need to be taking as an extra class, or if there are some of those 1,000 level classes showing up that are still needed, what you need to do to get that class waived or completed. The Module 2 or 2,000 level classes are classes that students have to take at Seattle University. So those are part of your graduation requirements that need to be taken at Seattle University. You can't transfer those in. There are 3 2,000 level classes that you will have to complete, and we'll look at what those specific classes are here in just a moment. There are Module 3 or 3,000 level classes that you have to take. Most students coming in as a transfer student will have one 3,000 level class that you'll need to take to complete those graduation requirements. And again, the 3,000 level class has to be taken at Seattle University as part of those graduation requirements. Okay, so what are those 2,000 level classes that you have to take at Seattle University? So the first one is the UCOR 2100 or Theological Exploration. So theological exploration is sort of the main umbrella category that these classes fall under. There are many topics that you're going to be able to choose from. So when you go into the class search and you're looking at UCOR 2100, each section is a different type of class. And so you'll be able to see those different topics. UCOR 2500, Philosophy of the Human Person, It is a little different from the UCORE 2100. It is one topic for all sections. It's our Intro to Philosophy class. And so it's going to be philosophy of the human person for each section there. So there's not going to be any variation on topics or content for the class. UCORE 2500 is the prerequisite to be able to take UCORE 2920, which is the ethical reasoning in healthcare. So these are the only two UCORE classes that must be taken in a specific order, where you have to take UCORE 2500 before you take UCORE 2920. Now, if you have a bachelor's degree or are what we consider a post-bac student in the cohort, this particular UCORE 2500 requirement is waived and you do not have to take that class. So the third 2000 level class is the UCORE 2920 or Ethical Reasoning in Healthcare. So that class is also a one topic for all the sections. It's ethical reasoning in healthcare. And again, we'll give you more specifics about the topic in that class when you get to that point of taking that. So your required 3000 level UCORE class. There are three options that are going to be possible for you to take your 3000 level class from. You're going to be able to take the UCORE 3400, Humanities and Global Challenges, UCORE 3600, the Social Sciences and Global Challenges, or UCORE 3800, the Natural Sciences and Global Challenges. Okay. Again, this is going to be a lot of different topics under each of those categories, and your program evaluation will show you which one it is that you will need. And then we will work with you in our individual advising sessions to talk a little bit more about those requirements. Again, like the UCORE 2500, if you have a bachelor's degree already completed and you're looking in your program evaluation and you're not seeing that, that's because this requirement is waived for students that have a bachelor's degree already. Okay, so I kind of mentioned it a little bit, but what is a program evaluation? So program evaluation is the Seattle University degree audit program. So at your previous school, they probably had a degree audit program that was called something, and that was where you tracked a lot of different information about your program. So in our program evaluation, you'll be able to see who your assigned advisor is. This is where you're also going to track what credits have transferred in for those Module 1 requirements and also for your prerequisites. So you'll see all of those in your program evaluation, and you'll be able to see when those have been satisfied or if they still need to be satisfied. It's also where you're going to track what classes you need to complete your program. So all of those nursing classes that we just talked about are also going to be listed in your program evaluation. And we will work with you as you go through the program and just make sure you're on track with those classes. And in the fall, we will review your individual program evaluations. And then for anybody that schedules those individual appointments, we'll also be going over your individual program evaluation at that time as well. Just kind of doing a check-in to see how things are looking and what might still be needed to get transferred in. The program evaluation is also where you're going to track your cumulative and major GPA levels. And so we'll show you where to find that in the program evaluation when we meet with you in our advising appointments as well. So if you haven't been able to find the program evaluation in your student portal yet, you'll sign into your My Seattle University student portal. And then when you sign in, there's going to be quite a few buttons in there, but on the right-hand side, there's one that says Student Planning. And so you'll see that button there. When you click on that, it will refresh to a new screen that looks something like this. So to see your program evaluation, you're going to click on the button to the left that says, or the link that says, go to My Program Evaluation. And so that's how you get to your degree audit. Okay, so kind of circling back to those three classes that you're going to take for the fall quarter. As we mentioned, you're going to be taking Nurse 3205 Pathophysiology. This class meets on Mondays, Wednesdays, and Fridays. So you will be expected to be in class all 3 days, Monday, Wednesday, Friday. Now, when you go into the class search, and if you're kind of looking in that the planning tool, you might see that there are 3 sections listed. BSN students will only be able to take section 1 or section 2. Section 3 is showing full because it's blocked out for, because that's the section that's for our diagnostic ultrasound students. So our nursing students are not able to register for Section 3 for pathophysiology. So your second class will be that Nurse 3405, Health Assessment and Interventions. That class also will meet on Monday, Wednesday, Fridays. And when you look in there, there's going to be lots of sections. So I think there's 8 sections listed, and it's going to be divided into 2 time groups. The first time group is the Monday, Wednesday, Friday from 8 to 11:30. And those are sections 1 through 4. And those sections are going to be ones that work with or pair with the pathophysiology section 1. Sections 5 through 8 are going to be the sections that work with section 2 for pathophysiology. And so just make sure that when you're registering for those classes that you're getting the correct sections for those 2 options. The third class that you'll fill in the remainder of your schedule with are those UCORE classes. Most UCORE classes are going to fall on a Monday, Wednesday, Friday offering or a Tuesday, Thursday offering. And again, for adding for your fall quarter, you're going to be able to add UCORE 2100, UCORE 2500, or one of the 3000 level classes to your fall quarter. So as you can tell, because there are only 2 sections for pathophysiology and health assessment, the cohort is going to be divided in half. So what that's going to look like is half of you will do option 1, half of you will do option 2. And then you'll kind of get to know each other in the smaller groups of your health assessment classes as well. So for those of you who like a visual of what your schedule is going to look like, this is what option 1 will look like. So taking your health assessment in the morning and then sort of that afternoon pathophysiology. It leaves you time to do like a late afternoon UCORE class on Monday, Wednesday, Friday. Or you could also take a Tuesday, Thursday UCORE class. For option 2, right, you're going to have your pathophysiology that's a later morning and then your afternoon health assessment class, but that leaves you to time to possibly fit in an early morning UCORE class on Monday, Wednesday, Friday, or to also, again, plug in a Tuesday, Thursday UCORE class. So kind of side by side, you can kind of see these are the 2 options just as a comparison. When you go in to register for your classes, there are still spots open in both pathophysiology classes. So once one of those sections are full, you are not able to register for that section. Those sections, once full, we can't override those capacities. So we can't put you into a section that you prefer if that section is already full. So if those sections are full, you would have to go in and adjust your plan and register for one of the other sections that do have spaces available. Okay, so when you go into your schedule, you're going to see a course plan tab, and then you're going to see a timeline tab. Now, in your timeline tab, you're going to be able to see it's like a timeline view of each of the quarters, and they're going to show the classes that you're going to take in each quarter. So when you got admitted to the program, we uploaded a template, and that's what's showing in this timeline view is this template that we uploaded. It's going to show you places for the placeholders for the UCORE classes, so you'll know what quarter you're going to have those UCORE classes. And then it's going to list the nursing classes that are planned for that quarter. But you will have to still go in and choose your sections and sort of plan out your schedule for each quarter. So when you log into your portal to find your plan and schedule, you'll again log onto your portal, click on the student planning button, and then when you get to this page, you're going to click on the link that says go to plan and schedule, because that's where you're going to plan and register for your classes. When you get into your plan, you'll see the fall quarter will show up, and you'll see some tiles on the left that look similar to this. There's the placeholder that lists out the UCORE options for that Module 2 requirement. It'll show your pathophysiology, your health assessment, But if you see this yellow square with the triangle here, that means you have a prereq error, which means somewhere in your portal, we are missing one of the prerequisites that are needed for that pathophysiology. That might be a class that you completed in the winter quarter and you're waiting for your transcripts to process through. Those might be classes that you're currently taking in the spring quarter and you're just waiting to get those final grades. If you see that as a prereq error, you will not be able to register for pathophysiology on your own. You'll have to notify your advisor that that prereq error is there and it's blocking you from being able to register, and then we will have to manually register you for that class. One of the things to help us know what section that you prefer and to be able to register for is to click on this little link here underneath each of the classes that says View Other Sections. So that's how you're going to see what sections are available and know what sections are full. So when you click on that link, it'll take you to a page that looks similar to this, and you'll see the different sections sort of listed underneath the class. One thing to note, as we've already mentioned, health assessment has more than 6 sections. And so to see all of those sections, you'll look here. And if you in this little square, you see a 1 of 2 or 3, that tells you that there are multiple pages of sections to scroll through. So you'll click on this little arrow to toggle forward to the other sections and see what those are and see if those have spaces still available. That's going to be particularly true when you are looking for your UCORE classes. So you can see here for UCORE 2100, there are 3 sections, 3 pages of sections to look through to choose from. So if you're not finding any UCORE sections that are available or that have spots open, you might need to toggle forward to look for some other sections available. You'll be able to see, it's kind of hard to tell in this view, but the sections that have spaces open will have a number in this first little category. That's how many spots are still available. The second number is going to tell you how many maximum spots are available in that class. The third number is for the wait list, but there are no wait lists for any nursing classes or UCORE classes. So you'll never be able to wait list for any of those. You will see some of the sections that will show up as they'll say section is full, and that will be red, and then you'll know to continue looking for open sections. So for those of you who like a step-by-step list, these are the steps to actually choosing and planning your sections in the student portal. Kind of again, going into your portal, clicking on those buttons, click on the View Other Sections to add the section to your plan. Now, one thing to note is when you are doing all of this and you're planning those sections, it is not reserving a spot in that class for you. It's just visually showing you this is what your schedule would look like if those spots in those classes are still available. You are also not actually registered for your class once you've planned your sections. You will actually have to click a button that says accept terms and register for planned sections. So planning your sections does not register you for those classes. Again, just to reiterate, if you're going in to register for one of your pathophysiology classes and the section you prefer is full, we are not able to override that capacity. You will have to choose and register for the other section. So how do you know once you go through all that process and you've clicked that blue button that registers you for your classes, how do you know for sure? So you will visually see all of the yellow boxes here will change and they will go from planned to registered but not started, and they'll be green. And then you can see on your calendar, the boxes here will turn green. So that's the green light that says you're good to go. Those classes are all registered. Okay, so you've got your UCORE placeholder on your timeline, but you're not sure how to add a UCORE class to your plan. So these are the steps to going through the class search to be able to add one of those classes to your plan or one of the classes and sections to your plan. So you'll find your little search box right above the calendar on the right-hand side of your planning tool. There's a little search box and you'll type in UCORE 2100, for example. Now, when you get to that class search option, make sure you go to the left side and on the filters, you're going to see a section called term. Make sure you select and click the box that says Fall Quarter 2025 so that you are only seeing the fall quarter classes. Right now, if you don't do that, you're going to see winter quarter classes and spring quarter classes, and they're not going to be available to you. So again, make sure you're going to the left, clicking that term for fall quarter 2025. Then it will take you into seeing those classes. You can add the section to your plan, and then you'll be able to register once those are in your plan. Okay, so that's all the steps on how to plan and register for your classes. Fall quarter is going to be all of your programs and your classes in the program are going to be in person. There might be, and you'll see some of those UCore classes be like online asynchronous options. Right now, those are all full, so you'll have to choose another UCore. But you can watch those UCore options and see if spots open up over the summer. But for right now, those are all probably full when you go in to look. But please anticipate that you will be attending all of your classes in person. Um, COVID vaccinations are required by our clinical partners. So COVID vaccinations are no longer required by the university, but they are required by our clinical partners because our clinical partners are hospitals, healthcare centers, and healthcare areas. So their requirements supersede our university requirement. So to attend clinicals, you will be required to get a COVID vaccination. So there are no exemptions for that. If you have any questions about that, please talk to us as your advisor, but know that there is nothing that we can do. There are no exemptions, there's no forms or anything to get out of those COVID vaccinations for clinical requirements. All right, so registration actually opened on June 2nd. So there have been students that have already been able to go in and register, which is why you might be looking at some of those sections and going, wow, there's not very many seats left open. So this is a makeup session for those of you that maybe weren't able to attend the previous sessions or maybe were just admitted to the cohort. Just know that at the end of this session, we'll remove your new student hold, and then you should be good to register for any of those classes as long as you don't have a prereq error. If you have issues with registration, you'll be able to watch and look for some port videos that are on the website. You can also email us at conadvising@seattleu.edu, and we'll address those emails probably tomorrow. We're not going to be addressing any of those registration emails this evening, but we will address any of those tomorrow. You can also schedule individual appointments with your assigned advisor. If you've already done that, that's fantastic. That's already taken care of. If you finish this session and you still have additional questions, we definitely encourage you to schedule an appointment to meet with your advisor. So again, if you have a prereq error as you're looking in there and you have that prereq error for pathophysiology, you'll have to be manually registered by your advisor for that class. Again, just to kind of talk about how you know if you have that prereq error, you'll see on that calendar view, you'll see this yellow square with the triangle in it. If you're looking in your timeline view, you'll also see this, and that will note a prereq error, and you won't be able to register for that class. Some of you may have already been looking at like the notifications and notice that you have a new student advising hold. That hold does prevent you from being able to register until you've attended an advising session workshop or have met with your advisor. So that hold, for those of you that are attending this workshop but haven't yet met with your advisor, those holds will be removed at the end of this session, and then you'll be good to register. So we do like to talk a little bit about costs. Your tuition costs and fees can be found on our website. You can just type in tuition. There's also a tuition and fees link on the website that you can look at. Our tuition alone is going to be $19,275 per quarter, but there are other fees that will get added. But there is also an additional fee that we like for students to be aware of so that it doesn't come as a shock, and that is the nursing fee. The nursing fee currently, as we are meeting today, is $490 per quarter that you're taking nursing classes. So those fees are to cover, like in the clinical performance lab, when there's supplies and instructions and things that are going on in the clinical performance lab. It's to cover some of the like UWorld subscriptions that you have when you get into your senior year that we provide for you. There's going to be a lot of different things that that nursing fee covers. But there will be some additional costs that are going to come up as you go through the program. So those things are going to include scrubs, supplies, your textbooks, a background check, transportation to and from your clinical sites, parking fees at clinical sites. If you think about a clinical site at a hospital, some of those do charge to park on site. So those will be an additional fee for you as a student. When you graduate, there's going to be an NCLEX exam fee, and then there'll be just some miscellaneous fees that will probably come up for you as you go throughout the program. So speaking of textbooks, one thing to note as you're going through and you're looking at the textbooks, there might be listed a safe Medicate. Please do not purchase that early. You will get access and set up with Safe Medicate as you get ready to start the fall quarter by your health assessment instructor. So please do not purchase or pay for Safe Medicate from the campus bookstore if you see that as listed required materials. Okay, so next steps. So next steps are going to be to complete your new student orientation checklist in that orientation portal. Complete your BSN transfer checklist items. That's a checklist that we're going to cover here in just a minute. Watch for an email over the summer, so sometime in July, for your Clinical Placement Northwest or CPNW registration and your BSN health packet and background check information. So again, that will be emailed out to your Seattle University student email only. It will not go to your personal email. While you're waiting, if you're curious, like what are all these health requirements that are going to be required, you can find those on our website. And you can kind of get an idea of what those are going to look like before you get the packet in July. You'll start purchasing your supplies. And again, we're going to talk with you about what supplies are going to be needed for the fall quarter here in just a minute. The first day of class is going to be Wednesday, September 24th. Watch your emails over the summer to your SU email for more information from your advisor, from some of your faculty as it gets into early September, and then again from our clinical folks and our compliance manager as you get that BSN health packet in July. We'd like for students to attend the college induction day that happens on the Monday before the start of classes. So that will be September 22nd. And then make sure you're accessing your College of Nursing Canvas page for that Safe Medicate access and more that will open up in September. So again, those are all emails that you're going to get as it gets closer to the start of the fall quarter. So that ends the presentation. So if you give me just a minute, I'll transition over and we're going to go over the BSN student checklist really quick. Okay, and then we'll open it up for questions. Okay, so hopefully, Grace, can you see the checklist there? Sweet. Okay. So hopefully that's big enough and you can see it. Again, please don't worry about trying to take notes or anything with this. This is part of what we will send out to you. So you will have this and at your Seattle University email to access again. So getting started, we'd like for you to, again, if you haven't already, access your SU email. If you're not sure where to find that, you can go to our main website at seattleu.edu, scroll all the way to the very, very bottom in the section at the very bottom that is black. It's sort of in the middle. There's a lot of different links. One of them will say email or my SU email. So you'll click on there to set up that SU email. Verify your financial aid. So make sure you're working with your student financial services counselor or advisors if you have any questions about your financial aid. Finish any of your prereqs that you may have in progress and work with your admissions counselors if it looks like that might not happen. As you finish up those prerequisites and finish up like your DTA or direct transfer agreement associate's degrees, make sure that you are submitting your official transcripts. So we have a lot of students that have submitted their transcripts already to their admissions counselor, but you will have to do that each time you have classes that you've completed so that they can see those classes, that have a final grade, make sure that you've met the minimum grade requirements, and that we can get those transferred in. Please note that official transcripts have to come from the school you're attending and be submitted directly to Seattle University. So your admissions counselor might tell you, if you send me the official transcript that you have, they can use that to enter in and show that you've completed those prereqs. But to actually transfer in the credit so that it applies to your program evaluation and shows those prerequisites as a completed requirement, you will have to submit an official transcript from school to school. It is an unofficial transcript if it comes from you, the student, to the admissions folks. So they're using those as an unofficial transcript when they do that. Okay, so submitting your immunization records to Student Health Services. So on your new student checklist in your orientation, it has a health requirement for those immunization requirements. If you've already completed that, that's great. The system for the Student Health Services and university immunization requirements is different from your clinical immunization requirements. It's a very different software program. They're in two different places and they don't talk to each other. So we hear all the time, like, I already submitted my immunization requirements. Why am I being asked to do this again in July? And it's because those two systems don't talk. And your clinical immunization requirements are much, much more expansive and have a lot more requirements than the university requirements. So again, you're going to get that BSN health packet that's going to outline all of those immunization requirements, and that will come out in July. Check your Red Hawk Hub. So the Red Hawk Hub is sort of our internal platform where you're going to be able to access a lot of student forms. Also, parking information is in there. There's a student resources little drop down that's going to have a ton of information and links that you're going to be accessing as you go through the summer to access a lot of different forms or requirements or parking permits and information. If you're not sure where to find that, definitely reach out to us. One thing that I do like to mention here is there is a cohort channel that typically gets created each year. So we ask at this time for volunteers to kind of step forward to set up this cohort channel. So for example, the current junior transfer cohort, last summer, somebody volunteered. They let me know they were willing to volunteer. They set up a Discord channel, and then they used that to we send out a link and they use that to get to know each other over the summer, to share information about, like, where are you getting scrubs? What types of shoes are you getting? What stethoscopes did you get? Did you get this? Where did you find this? So you can all share information as a cohort. You will be some of the best sources of information for each other as you go through the summer, but then also as you're going through your classes. For example, the cohort that's currently juniors also used it to organize folders for each of the classes and each of the sections so that they could share information as a cohort across those classes as well. So if there's anybody that is interested in setting up the Discord channel or Facebook channel or some sort of channel for you all to coordinate as a cohort, please let us know. You can email us at conadvising@seattleu.edu and just let us know that you're interested in setting that up. And then we will work with getting you connected with the rest of the cohorts once that gets set up. All right, so before fall quarter, you will need to complete your BSN health packet requirements. I believe the deadline for that happens like the week before fall quarter starts. So it will be listed in your BSN health packet. When you get that information in July, the deadline will be listed there. So make sure that you are completing all of those requirements by that deadline. Otherwise, it can delay your ability to start your clinicals in that winter quarter. So part of those requirements is being BLS CPR certified. So the BLS is the Basic Life Support or Healthcare Provider Certification for CPR. Now, some of you may already work as a CNA or work in a healthcare setting, and you might already be CPR certified, and that's great if it is an American Heart Association certification. If it is an American Red Cross CPR certification, that will not work, and you will have to get recertified using an American Heart Association CPR class. So if you have any questions about that, definitely reach out and let us know. Reviewing the nursing student handbook. Again, you're going to get access to this PDF, so you'll be able to access these links and be able to access all of these documents as well. But just make sure if you're not sure about policies or you just want to know where some general resources are, all of those are going to be in that student handbook. You will need to obtain an SU student campus card and a nursing ID badge. Those are two different things. You can access or order or request your student campus card online. You would submit that through our Super Copy office. And again, the link to that will be here on this sheet when you get that. You can submit a photo, so you can take a photo, you can submit it online. They'll set up your SU student ID card, but they will not set up your nursing ID badge. You will have to call or email and let them know that you are requesting a nursing ID badge for them to actually set that up for you. So again, you must order that in person or over the phone or via email, and then you'll pick up both of them in person, but make sure you have a photo ID with you when you pick those up in person. And then buying or renting your textbooks, again, you can go find those all through our campus store. All right, so all the fun stuff, your clinical and your uniforms and supplies. So we do require students to come to health assessment in the fall and into your clinicals in a navy blue scrubs for all of those clinical site requirements and when you're in your health assessment class. So for fall quarter, for that health assessment class, you will be expected to show up in the first week, preferably on the first day if you have your scrubs by then, but in a dark navy blue scrubs outfit. The College of Nursing patch is also going to be required so that you can be identified as a Seattle University College of Nursing student. So that patch can be purchased at the campus store, and then you'll actually sew it or iron it onto the left side of your scrub top. So your scrub tops are available at the campus store, but they can also be purchased anywhere else that you might buy scrubs. Just make sure that they're the dark navy blue. Scrubs bottoms also are available in the campus store, but they also can be purchased elsewhere. Again, just making sure that they're the dark navy blue. Scrub bottoms can be pants. They can be the cuffed pants, the loose leg pants, or they can also be the skirt. Shoes, we do request that those be professional shoes. They do need to be non-cloth, closed-toed, leather or pleather shoes. We recommend that they be white, black, or navy. I've listed a couple of really popular brands that students in the past have mentioned that they really like in a variety of cost levels, right? So you can hopefully find something that fits your budget with some of these brands. The main thing is just making sure that the shoes are going to be comfortable. So think about walking around in a 12-hour clinical in really uncomfortable shoes. Like your feet are going to kill you at the end of those clinical shifts. So make sure that you're getting really comfortable shoes that are going to last. We do ask that they be closed-toed because you want to make sure that you're protecting your feet, right? So there's a lot of different things in clinical settings that can really injure your feet or soak your feet. So think about body fluids, spilled food, different kinds of fluids that might be spilling on your feet, sharps, needles, all of that. With a cloth top shoe that can poke through really easily to your foot. And then there's forms and processes and a whole procedure that you have to go through for those. So please protect your feet. Make sure that they are closed-toed shoes for your clinicals. Wristwatch. A lot of folks have really fancy like Samsung watches or Apple watches. Those work fine as long as it has the ability to count seconds. So think about if you're doing vital signs and you're trying to do blood pressure counts, things like that. It just has to be able to count the seconds. Now, we do recommend that you get a fairly inexpensive watch to do just for clinicals because, again, sharps, things can get scratched, body fluids, lots of fluids in clinical settings that can splash and get on those really expensive watches, and then they might get ruined. So please make sure that you are getting whatever you're comfortable with wearing in those clinical settings. If you're fine wearing your Apple Watch or your Samsung Watch, that's great. If you want to keep those a little more protected, just look for a really inexpensive watch that counts the seconds. Stethoscopes. We do require that these be dual head, bell, and diaphragm stethoscopes. The price range on these should be about $50 to $100. They do have to be the adult physical size. So please do not buy an adult size and a children's size. You'll be able to use the one adult size stethoscope for all of your clinical settings. That's why we require the dual head, bell, and diaphragm. I have listed a couple of common brands for stethoscopes, but I do recommend that students go online and do your own research. I went on YouTube, Instagram, TikTok. You can find lots and lots of information about things to look for and things to be aware of as you're getting ready to buy a stethoscope. So there are some things that it would be good for you to kind of be aware of. I found some really interesting information out about stethoscopes that I did not know when I did that. So just go on, search for stethoscopes recommended for nursing school. And you're going to find a ton of information and just sort of take some time this summer to review those as you start thinking about what manufacturer or what type of stethoscope you want to get. White lab coat. It is on the checklist because we do have some clinical sites that do require a white lab coat. However, not all clinical sites require a lab coat. A lab coat is only going to be needed if required for that clinical site. So you can buy a white lab coat, but you can also wait and only buy it if you happen to be placed at a clinical site that requires it. So you can buy it at that time. Your clinical instructor will let you know if that is something required for that particular clinical site. But most of our clinical sites have moved away from students wearing those white lab coats. So again, just a really important note when you're choosing your nursing gear, please keep safety in mind. Consider your clinical settings, lots of splashing, lots of fluids, lots of sharp objects, okay? The last little page here is about scholarship information. So hopefully you have already been in and seen and or logged into your portal and been able to see the scholarship universe access. If you've been on our College of Nursing website page and you've seen those endowed scholarship lists, all of the applications for the endowed scholarships are going to be housed in that scholarship universe portal, and the applications opened on April 1st. So if you haven't gone in and applied, there's still plenty of time. You can apply for those over the summer. That said, and again, you'll get a copy of this to your email, so you don't have to write these down. We do list quite a few common and what we have known are scholarships that nursing students have applied for and that are helpful. So some are identity-based, some are specific organizations for nursing, some are just general resources, and just general specific scholarship links. So again, you'll get a copy of this to your SU email in the next day or so. So you can start checking out some of those other scholarships that are listed here. Okay, so that covers the new student checklist and all of the things that you need to know for registration. So this is the point in time where I am going to stop talking and you guys are going to have the opportunity to now ask questions. So you can raise your hand, you can just unmute and ask your questions, or you can also just pop your questions in the chat. If you pop them in the chat, please make sure, unless it's personal information, please make sure that it's visible to everyone so that everybody can see your question as they might have a similar question. All right, so now this is where I stop talking and you have the opportunity to ask questions. All right, so first question, if you have a yellow triangle under requisites, an academic advisor would have to manually assign you the classes you want in your academic advising appointment. Yes, you would have to have your advisor manually register you for the class, that pathophysiology class, if you have that showing up in your planning tool on that left side. That can happen in your advising appointment, but you can also just email us and say, hey, I was trying to register and I have that prereq. can you please manually register me for that class? That way you don't have to wait for your appointment in case your appointment is scheduled for like next week or later this summer. Okay, so currently taking pre-calc this quarter, have the math prerequisite notification. Yep, on the pathophysiology. Yes, you would email your advisor directly and let them know that you have that prereq error, and then we will manually register you for that class. Great. Any other questions? Ah, great. Thanks, Grace. Thanks for posting our emails there again. So if you need our emails, those have been posted in the chat, so you can copy those from there. I got BLS certification for CPR from Green River College 2 months ago. If it was an American Heart Association certification, you're probably fine. You would just upload that to the that CPNW account when you get that access to that account in July. If there's any issues with that, Leslie Huffman, who is our compliance manager, will let you know. But if it was an American Red Cross, you will have to do the CPR certification again and get American Heart Association certified. I just want to confirm clinicals will start during the winter quarter. Yes, your first clinical will be in the winter quarter of 2026. So it'll be January 2026 is when you'll have that first clinical class. Yeah, thanks, Grace. Any other questions? Okay, so if you feel like you have all of the information that you need to be registered for classes and to follow up with your advisor as needed, that's the end of the presentation. So you can certainly log off. There's nothing else that you need to do. We will be removing those holds at the end of this session. So nobody's hold will be removed yet. So you can't register until that's lifted, but we will lift that before we sign off for the evening. So watch for that. But otherwise, you can certainly feel free to log off if you would like. Okay. Is American Heart Association? Yes. Okay, so then you should be good. When does start class registration on June? Yes, registration actually opened on June 2nd. So once we lift that new student hold at the end of this session, then you'll be set to register for any classes as long as you don't have a prereq error. I'm a first year student. Is my registration process the same? Yes, Harleen, yes. Your registration process will be the same. You would just work with me if you have any of those prereq errors, and you'll follow everything that all of the other students in the transfer cohort would follow. Is it possible to order my transcript from my school to Seattle University through Parchment? Yes. If your school uses Parchment, you would go through Parchment to submit and request an official transcript be submitted from that school to Seattle University. Yeah. My BLS certification from American Heart Association needs to be renewed in January 1st, 2026. Great question. Because that actually is expiring before you start your clinical class, you will have to have that renewed. Even though you start your classes in January, your CPR certification and your immunizations and all of those have to be good through the full winter quarter till the final day of winter quarter. So you'll actually have to renew your CPR certification before you can start clinicals. And that's going to be one of your health packet requirements. So I would say renew that sometime over the summer or right before the fall quarter starts, because it is going to be one of your health packet requirements to have that completed before the start of winter quarter. And it does have to be good all the way through that winter quarter. I did COVID-19 in 2021 and 2023. Do I need the third dose of COVID-19? That is going to be something that your clinical instructor will let you know. My guess is you will probably have to do an updated COVID vaccination for your clinical requirements. Your BSN health packet will outline more specifics about those COVID-19 requirements as part of that BSN health packet requirement. So you'll follow the guidance in the BSN health packet when you get that in July as pertaining to those COVID-19 vaccinations. And if you have questions about those, you'll reach out to our compliance manager, Leslie Huffman, and her contact information will be on the health packet. Yeah, great question. Any other questions? Okay, quiet group. No more questions? Perfect. Okay. So if there are no other questions, like I said, you can certainly feel free to log off. And then we will start lifting those new student holds. So those of you that can register can get registered. If you have questions, we have until 7 o'clock. Um, so we certainly still have time for questions. You're welcome. Yeah, thank you for showing up for today. You're welcome. So Rona, Sophia, Harleen, do you all have any other questions? You're welcome. Have a good evening. Sophia, okay, a bit related. I have trouble fully understanding the credit transfer evaluation site. 90, I mean, credits needed to begin in the fall quarter. So on your progress bar, I'm assuming that's what you're talking about. If your progress bar shows green and 90 completed credits, that just means that you've transferred in 90 credits. Your progress bar includes your transfer credits. Um, so yes, you would have those 90 credits that are needed in the system to start your fall quarter classes. Is that the what you were looking at is the progress bar? I was told by the advisor to complete only Math 141. So Math 141. So that or by your advisor, are you meaning like your admissions counselor? Yeah. Okay. So you'll be following the guidance that your admissions counselor is telling you in regards to anything with those prereqs. The College of Nursing advisors are not able to see anything or evaluate any credits or classes. That all of that process happens with the admissions counselor. So if that's what they're telling you, that if that's the only that you only need to complete the Math 141, then you would follow that guidance. Are you showing in your program evaluation additional classes are needed? Is that what you're concerned about? Yeah. Okay. So if you if you have other classes that are still showing, it might just be that they're waiting for the transcripts to be submitted for the any classes that maybe you completed in the winter quarter, but they don't have a transcript that shows the finished grades. So that might be why some of those classes might still be showing as needed, but you maybe have completed them. Any classes that you have in progress this spring quarter also are not going to show as satisfied in your program evaluation. So I'm actually going to stop recording.